Hello everyone, I am Sneha, lecturer, Department of Physician Assistant, SNS College of Allied Sciences. Today we are going to see about case study on pneumonia. Before entering into the topic, let me see patient case history. A 60 years old male patient came with the complaints of fever, protective cough and dyspnea for past 4 days. These are the major symptoms for pneumonia. Patient will have fever due to infection and a protective cough due to lung damage and dyspnea means breathing difficulty for past 4 days. Past history and personal history will be explained by Rajlakshmi.
In past history, the patient has COPD in second stage and type 2 diabetes.
Patient is a known case of two major diseases. The first one is chronic obstructive pulmonary disease. It is a chronic obstruction in the lungs, and also second one is type 2 diabetes mellitus.
And personal history of the patient has smoking past 10 years.
Patient has a personal history of smoking for past 10 years. Due to this habit also, it will lead to lung damage. Next, vitals will be explained by Arambadathan Aunty.
Vitals BP 130 90 mmHg, heart rate 92 beat per minute, SpO2 89%, temperature 39.2 degrees Celsius.
In this vitals, BP is normal, heart rate is also normal, SpO2 is slightly abnormal. The normal SpO2 level is 90 to 100% in human lab. For this patient is having 89%, that is abnormal low level, and also patient is having elevated temperature due to infection. Next, general examination, systemic examination will be explained by Lakshmi Priya.
General examination, conscious, orient, brain, no pallor, no interest, no cyanosis.
Patient is on general examination. Patient is febrile due to increased temperature.
Systemic examination, serious, S1, S2 normal, respiratory system, decreased breath sound, crackles.
Patient is having decreased breath sound due to chronic obstruction in the lungs, and also crackle sound is present, that is abnormal lung sound due to infection and also COPD.
CNS, NFND present, bare abdomen, soft present.
Other systems are normal, only respiratory system is abnormal due to patient is having infection in the lungs. Next, investigation will be explained by Kamita.
Investigations, WBC 18,400, normal value of WBC is 4,000 to 11,000.
WBC is abnormally elevated due to infection. If patient is having infection, the WBC level will be raised.
CRP level 245 mg per liter. Its normal value is less than 10 mg per liter.
CRP is a C-reactive protein. It is a protein which is elevated by inflammation. Patient is having lung infection, so CRP is elevated.
Procalcitonin, 2.8 mg per ml. Normal value is 0.05 mg per ml.
This is also elevated due to infection.
Sputum culture, Streptococcus pneumonia is positive. Urine,
Due to infection in the lungs, we will suspect the patient is having similar lung infections. So we are doing a sputum culture. In this sputum culture, patient is having Streptococcus pneumonia positive. So it is a bacteria which causes infection in the lungs.
urine culture, pneumococcal antigen positive.
In urine culture also bacteria present.
Chest X-ray and bronchogram.
Chest X-ray is also abnormal. So these investigations indicate patient is having infection in the lung. So we are diagnosing this patient as bacterial pneumonia. Before going to see the bacterial pneumonia, let me explain what is pneumonia. Pneumonia is the inflammation in the lungs which affects air sacs, which is called as alveoli. These alveoli is the major structure which helps for gas exchange, such as from transporting carbon dioxide into oxygen in our body. So if alveoli is affected, we will get low oxygen levels and also abnormality in the lungs. There are many types of pneumonia. The one is bacterial pneumonia, viral pneumonia, fungal pneumonia and others. Patient is infected by bacteria means it is called as bacterial pneumonia. Patient is infected by virus means it is called as virus pneumonia. Patient is infected by fungus means it is called as fungus pneumonia. Patient will have symptoms like fever, chills, cough and low oxygen levels. For this patient we are diagnosing as bacterial pneumonia due to presence of Streptococcus pneumonia. For this condition we have to treat the patient with antibiotics. It differs from the types of pneumonia. Patient is having viral pneumonia, we will treat with antiviral drugs. Fungal pneumonia, we will treat with antifungal drugs. For this patient, we will decide the treatment for bacterial pneumonia is antibiotics. So we are treating the patient with antibiotic drugs like ceftriaxone and azithromycin.
Supportive care, O2 therapy, IV fluids.
Why we are giving O2 therapy for this patient means patient is having low levels of SpO2 and also patient is having dyspnea. So to correct the O2 levels and also treat the dyspnea, we are giving O2 therapy and also IV fluids for nutrition.
Outcome, hospital stay 7 days. Discharge afebrile, SpO2 97%.